West Michigan is bracing for that heat wave headed our way. It may be a great opportunity to head out to the beach, but be careful. We all know that the heat can certainly be dangerous. And joining us right now to talk more about what to watch out for safety's sake is Dr. Randy Duthler, a family practice physician from Metro Health Southwest. Thank you so much for joining us tonight, Doctor.
Thanks for having me.
Let's talk a little bit about what to expect if we see somebody going through heat exhaustion. How can we recognize that?
Well, heat exhaustion is a little bit milder than the typical heat stroke, so the patient usually experiences some dizziness and fatigue, headaches sometimes, and a profuse sweating.
What about, I noticed that one of the symptoms that we have up on the screen right now is cool, moist skin, which would really sort of go against what you'd think somebody would be experiencing that was hot.
And that's a really important feature, actually, that when the person is going through heat exhaustion, the body's trying to cool itself. It's still able to pump moisture out to the skin in hopes of evaporating the moisture and drawing the heat away. As you progress towards heat stroke, that's when you start to notice dry, hot, red skin, and that's more worrisome. Okay,
well, we also have the symptoms for heat stroke. If we could bring those up, let's talk a little bit about that. You're saying a lack of sweating and maybe even a nausea or vomiting. Can we talk more about that?
So loss of sweating, nausea, vomiting, dizziness, sometimes personality changes or confusion, ataxia or inability to walk straight, and sometimes even loss of consciousness, depending on the severity.
And muscle cramps, I'm noticing, and weakness that way. The body's really just giving up.
It really is, yeah. And usually people will note themselves going, in the direction of heat stroke as they progress. So, if they recognize the symptoms and are able to slow down, get in the shade, get some water, they can reverse that process.
Okay, so what to do then? Get some water. Make sure and stay hydrated during this whole thing. Get into the shade. When should somebody seek medical treatment?
I think any time they think their symptoms are rapidly progressing, or if they have any history of heart disease or diabetes or asthma or any kind of cardiovascular disease in general, those patients should probably seek earlier attention. Children less than age 4 are at higher risk, as well as the elderly.
Okay, so the certain populations more at risk would be the children and the elderly. It's something really that parents need to watch out for.
Absolutely they do, and every year you hear about a child who's been left in a car, and boy, we just can't reiterate enough how important it is to never leave your child in the car for even a short amount of period. And if you were to witness that, I think that's definitely 911 appropriate to call.
Right, and kids can't always communicate what they're feeling, so it's important for parents to really pay attention and watch this. Dr. Duthler, thank you so much for joining us tonight. We appreciate it.
I appreciate you having me.